My name is Sar Danon. I am a pediatric interventional cardiologist.
My name is Curtis Kretschmer, and I work at Cardinal Glen Children's Hospital.
My name is Charles Huddleston. I am a congenital heart surgeon.
Mi nombre es Jorge Rosado. Soy intensivista y cardiólogo pediátrico.
I've been a part of this brigade for the past 8 or 9 years.
The main purpose of the brigade coming to Hospital María is to assist them in the development of their program for open heart surgery in children. And perhaps most importantly is the development of improved care in the intensive care unit for those children who have had heart surgery.
Las expectativas es que podamos darle una buena oportunidad a todos estos niños que necesitan esta cirugía. Muchos de ellos llevan años esperando para poder ser operados.
Every time we have a brigade, our goal is similar. We want to have the best possible outcome for the largest number of children that we can care for. For this brigade, we're doing both cardiac catheterizations and surgeries.
We review every patient that could conceivably been helped. We triage, we prioritize, and we determine, okay, which of these cases are we going to take on this week to try to do as much good as possible.
Nos da mucha alegría poder estar aquí para proveer nuestros servicios, nuestro conocimiento y darles una oportunidad nueva después de tanto tiempo esperando.
The number of children born with congenital heart disease in Honduras currently far outweighs the capability of the institutions to care for these children.
There are always far more patients than what we could possibly treat in just a week.
Perhaps about 10% of all of them are getting adequate care.
There's hundreds of children in Honduras that need them. The other big challenge is lack of equipment. There's not a lot of devices and equipment, unfortunately, available here.
El equipo quirúrgico hace mucho con menos y hace muy buen trabajo, pero con menos recursos de lo que usualmente nosotros utilizaríamos en los Estados Unidos, por ejemplo.
I really appreciate everything that the team here tries to do with what is very limited resources, but they're making do. They're doing the best with what they have.
Working in the United States of America, we take a lot of that for granted. We have everything available to us. There's a large cost. These devices are very expensive.
I imagine it's such a challenge for the hospital and the country to provide state-of-the-art care given the financial constraints that are posed.
They were developing the expertise, and that was coming along very well. I think that's the main challenge.
Unfortunately, a lot of the limitations are financial. So if someone is able to make a donation to be able to purchase more equipment, that impact would be huge because you could potentially help save many lives with a relatively small donation.
Any amount of money would make a difference. There are machines available that would be put into use here that would improve patient outcomes, that would save lives if they were just available.
This hospital ought to be a shining jewel for the country of Honduras. The capacity to really be the place where all children in the country come for their heart care is possible at this institution. With the proper support from either the government or from private donors, they could easily achieve this goal.
Eso es uno de los aspectos bien importantes de estas brigadas, es que se puedan brindar no solamente nuestros servicios, sino que puedan haber donaciones para apoyar con equipo médico, cosas que se necesitan todo el tiempo para poder cumplir con todas estas cirugías.
What we hope to do is inspire others to take on some of this.
There are a lot of memorable moments from our years of coming here. They all stem from the families and the interaction with the children and the families and how grateful the families are. And that's really why we do this, so we can help provide care for these kids.
I love that I can pick some of these kids up and hold them and just give them that love and affection to help them overcome the anxiety, the pain, the discomfort that they're having. Sometimes I just can swoop in and grab those little munchkins and carry them around the room and say, hey, look at who I got. This kid's gonna be okay.